Today I'm going to talk about how we manage unowned cats in situ at RSPCA New South Wales. We designed this project because of cats like this. So unsocialised adults who would arrive at our RSPCA shelters in their thousands every year, and most of whom were killed because we couldn't rehome them. And also cats like this, the neonate kittens, the orphaned kittens, the litters of kittens with their mums. We wanted to try and turn this around, keep cats out of shelters, improve the quality of their lives, and help people who are overwhelmed trying to care for them. To understand what we can do to help in this situation, a good place to start is to understand how the whole system works. So we've got lots of cats in Australia. They're all of the same species. They can move between populations during their lifetime, but it's still helpful to think of at least 3 different populations of cats based on the relationships that they have with people. So we've got owned cats, which is pretty straightforward. They're usually socialised. They're identified with and cared for by usually a single household. And then we've got feral cats, so they're unowned, they're unsocialised, they have no relationship with or dependence on humans. They're out in the bush and they're hunting to survive. And then we've got these unowned cats in between. So these are the really important ones that we are interested in because they're mainly the ones coming into shelters. And what we find is most, maybe all, unowned cats are semi-owned in reality. So that means they're deliberately cared for by people, but those people don't consider themselves to be the cat's owner. So we know we want to reduce the size of this unowned population. So what can we do? Well, we can desex cats. So we want to desex the unowned cats to prevent that population from growing. We also want to desex owned cats to prevent unplanned breeding in that population as well, because we know that contributes to the size of the unowned population. We also want to focus on human behaviour change. So we want to encourage that desexing behaviour, but we also encourage people to take responsibility for those unowned cats they're caring for. So adopt those cats, get them into safe permanent homes. And we want to prevent the cats ending up in that unowned cat population in the first place. We know that abandonment is a really important source of recruitment into that population. And then a third category of things that we can do, I think, are the services. So making sure that there are options available for people who want to rehome cats they can't keep anymore. Also keeping an eye out for cats entering the population through migration, to make sure the population doesn't grow over time. So that's where our StrayCare programs came in. The aim was to reduce the numbers of unowned cats. And we did that by partnering with local councils, with local private practice vets, with cat rescue groups to offer free cat desexing and also microchipping for people who wanted it. Focusing on caregivers of unowned cats, but also cat owners who are overwhelmed with multiple cats and having unplanned breeding. Importantly, we wanted to remove all or as many barriers as possible to getting that done. So trying to facilitate assistance with transporting cats, also assisting with trapping cats where there are unsocialised cats who are difficult to catch. And also, importantly, trying to incorporate that element of human behaviour change. So incorporating a social marketing approach where the target behaviours are, we want the community to notice stray cats. We want to mobilise the whole community. We want them to notice the cats and we want them to act to make sure they have a home. And of course, we also want them to get the cats desexed. But most importantly, we want them just to notice. Something we've also found has been really important as we've done more of this work is the secondary step of connecting these caregivers with other services. So connecting with access to veterinary care programs, connecting with veterinary social worker programs, connecting overwhelmed caregivers with opportunities to rehome cats, to get kittens into foster care, and connecting people who might have other challenges with human services who can help them. What we found quite consistently wherever we set up one of our cat desexing programs, now this is whether it's in the city or if it's out in the country, is that most of the cat management challenges in any area can be traced back to a relatively small number of multi-cat situations. These are often overwhelmed caregivers like Patricia here. They often face a whole range of complex barriers that prevent them from resolving the cat situations themselves. And this might include things like mental health or physical health problems, social isolation, there might be drugs and alcohol involved, or it might just be general socioeconomic disadvantage. We also see the issue of unowned cats intersecting with hoarding presentations in various different ways, but most of the caregivers we come across are desperate and grateful for our help. So Patricia here has very poor mobility and complex health challenges. She's also the sole caregiver of her terminally ill husband, so has a lot of things going on. A few years ago, she had one stray cat turn up under her house. Now, several generations of cats later, she had somewhere near 100 cats living under the house, and she feeds the cats, and she kind of likes having them around. They're able to come and go freely in and around the house, but she still considers that these are stray cats. Now, caring for the cats was actually preventing Patricia from accessing healthcare herself, which is a real problem for her well-being. So through the StrayCare program, we worked with the local council. We helped her to trap and surrender all but 2 of the cats, which was what she requested to happen. We returned those 2 cats desexed as her owned cats. Many of the cats we were able to rehome through local rescue groups and the local council. A lot of the kittens came into our foster care program through RSPCA and were adopted out as well. So working together with a whole bunch of local stakeholders to find a resolution for Patricia. Now, Anthony is a great example of where we can get better outcomes for cats and for their caregivers by using a case management approach rather than through enforcement. So Anthony is a hoarder of cats and of things, and our RSPCA inspectorate had been involved numerous times in the past and had trapped and euthanized large numbers of cats several times, just to have the situation recur again a couple of years later. So through StrayCare, we've worked with Anthony and also with his neighbours. So now we've got a relationship with Anthony. He calls us when there's a litter of kittens born and we take them into care. Meanwhile, we've been chipping away 1 cat at a time to get all the adults desexed. We're able to do this because Anthony trusts us, that we're not there to judge him, that we're there to help him and the cats. Another scenario that's very common is where a colony of cats is left without a caregiver, either when the caregivers died or moved away or gone into care or into hospital. So, for example, this situation in Taree, where there are over 50 cats left behind after their caregiver passed away. So these cats dispersed into the surrounding neighbourhood, and they ended up settling at 3 new feeding locations. So on this one, we got the call and we got involved through StrayCare. We worked with a local rescue group, and over the next 6 months, they worked with the local community, the local vets, to track down those cats, to trap them, take them into care if they were friendly or if they were kittens, or to find them permanent caregivers so that the ones that we couldn't rehome could be desexed and returned to their familiar environment. So through our StrayCare programs, we're into our second phase of the project now. The first phase was from 2021 to 2024. And now this project, in phase 2, we've already desexed over 7,000 cats since August last year. In phase 1, we piloted this approach in 11 diverse council areas across the state of New South Wales. In phase 2, we've been lucky enough to expand to 30 councils, including the original 11, which are the ones in green. We describe the approach we're taking through our StrayCare programs as managing cats in situ or in place. This is similar to TNR, but it's a bit different in that we're working directly with the cat's caregivers and that these are not always unsocialised cats and they're not always unowned. There are a few reasons why we think this approach works. The first one, cats are territorial and they breed really quickly. So by leaving the cats where they are, we prevent them from just being replaced by other cats. Also, these cats already have a home. Helping them to stay in their familiar environment means avoiding the stress of coming into a shelter, which is especially important for those adult cats who are unsocialized and who are really difficult to rehome. This means better welfare outcomes for the cats. Also, working with these cats where they are helps you understand why they were there in the first place, which means we can work towards addressing the underlying causes of these cat situations. We can also incorporate those elements of human behaviour change by working with all the people involved. And most importantly, it buys you time. It can take a while to trap and desex all of the cats at a site. If you're putting them back as you go, it takes away some of the time pressure. In the meantime, we can be working towards improving the health status of the cats, we can be improving their socialization, and we can be finding them homes one by one. Also, we're finding it's really important to engage beyond the primary caregiver of the cat. So often there's more than one caregiver as well, especially with the unowned cats. You might have half a dozen different semi-owners who are all deliberately feeding the cats and who all have a stake in their future. They all want to know that the cats are going to be okay, and they're often really important to get on the all of the caregivers. But then, really importantly, we're finding getting the buy-in of the land manager is critical. So the person who actually manages that piece of land where the cat is. That can be really variable. Sometimes it's the local council. Sometimes it's the transport service who owns the train line, or it might be a warehouse owner or in a commercial or an industrial area, or it might be a landlord for a private rental property. So getting those people's buy-in, getting them on the team, getting them part of the long-term plan is really important. Also getting the neighbours involved, and definitely the local council is really helpful. So these are some of the outcome results from our first phase of the project, so from 2021 to 2024. We did this intensive targeted desexing approach in 4 council areas in Sydney. We found that council pound intake reduced quite dramatically and quickly after we started the program, mainly because we're diverting cats from the pound in the first place. The cats that would have ended up in the pound, we were now desexing and managing in place. And because of that, council pound euthanasia went down even more dramatically. So we're really targeting those cats who might have been more likely to be euthanized originally. So those little kittens and those unsocialized adults. Nuisance complaints also resolved, and that's not particularly surprising. We're providing communities and we're providing with councils with a solution to a problem that people report all the time. So this is an approach that's really well received by the community. It was quite popular with a bunch of different stakeholders. We also estimated free roaming cat density using transect drives in 2 council areas. So we did this in the Blue Mountains and we did it in Campbelltown between 2021 and 2024, and we found that they actually reduced quite a bit as well, which is really encouraging. If you'd like to read more about our project, we've published some of the findings from phase 1, which you can download online. I'd like to say a very big thank you to all the Keeping Cats Safe at Home team, also to the vets and the councils and the cat rescue groups who've helped us to make this program a success. Thank you.